Okay, good morning to all of my dear friends and obviously my respected audience and students. In today's session, we are going to discuss professional negligence. So before I am going in depth of the discussion of this professional negligence, I would like to discuss some simple meaning of what is the meaning of negligence. Negligence means लापरवाही, आप कुछ ऐसा काम कर रहे हैं जो आपको नहीं करना चाहिए था. तो इन सिंपल टर्म निग्लेजेंस का मतलब होता है कि आप कुछ ऐसे काम को कर रहे हैं जो कि मेडिकली अनइथिकल है, जो कि आपको नहीं करना चाहिए था. सो इफ एनी doctors are doing some activities which are medically unethical, then we kept under medical negligence. So what are the definition written in a standard textbooks? In a standard textbooks they mention that medical negligence is a absence of reasonable degree of care and skills that leads to injury or the death of the patient. So if any medical professional who having absence of reasonable degree of care and skills that he having no proper experience for doing any examination or treatments, then it consider under medical negligence. So if there is the medical negligence is happening, then the two things will happen: either there is severe injury or the minor injury, or in some case there the death of the patient will also occurs. So on the board you can see that what it is: the absence of reasonable degree of care and skills that leads to injury and death of the patient. So if any person having injury or a death of the patient will occur due to the absence of reasonable degree of care and skills, it considered under medical negligence. In simple terms, we can say that doctors are doing some things that they should not have to be done, or doctors are not doing the things that should they have to be done. So if doctors are not doing some things which they have to be done, it is considered as act of omission. And if doctors are doing some things that he or she they should not have to be done, it is called the act of omission. For example of we take one of the example of act of omission and act of commission. So in act of commission, what I am telling to you, in act of commission, doctor are going to do such things that should they have to not to be done. For example, in case of burn injury, there is contraindication of giving a steroid injection, because steroid injection are immunosuppressive in nature, and during burn injury due to the hypovolemia and there are spinning of the skin, so there is higher chance of infection. So if any patient who having already the higher chance of infection, and in this condition we give any injection which decrease the immunity of the patient, then definitely you can harm the patient. So if we are doing such activities which generally harm the patient, that activity generally we should avoid it. But if we are going for this activity that which harm the patient, then it considered act of commission. On the other hand, what is the meaning of the act of omission? In act of omission, the doctors are not doing any essential activities that they must have to be done. For example, in case of a road traffic accident, the doctor must have to give him tetanus injection. But if any doctor, in case of the road traffic accident, they not give this tetanus injection, then it violate the rule of act of omission. So basically, in simple terms, we can say that the medical negligence is a such types of negligence where doctor violate the rule of act of omission and the act of commission. By example, I already explained it. So before we are going in further detail, I would like to discuss the meaning of two words. One is the plaintiffs and another is defendants. So in plaintiff means what? Plaintiffs are those person who file case in any courts, and the defendants are those person against whom the case is filed. For example, if I am going in any court like Supreme Court, Civil Court, Consumer Court, and a file case against accused, then I am a plaintiff. But if someone file case against me, then then I become defendant. Means in simple terms, if any person file case in court, then that person is plaintiffs, and any case is filed against any person, that person is act as defendants. So let's say in medical profession it is not very easy to become accused by any plaintiffs. So there are some guidelines that must have to follow by any plaintiff before file case in court. They must have to follow the 4D. What are the 4D? One is the duty, another is dereliction of the duty, the third thing is the damage, and the fourth thing is the direct causation. Okay, so before plaintiffs expect that any court given any punishment to the doctor, they must have to prove these four things. Without proving these 4D, there is no any case validable in any court. So what are the four things that plaintiff must have to prove in court? The first D is the duty. The plaintiff must have to prove that during the medical negligence, the doctor is on duty. If doctor are not on duty, then no any case is valid here. The another thing is the dereliction of the duty. Dereliction of duty means basically it is a negligence. Plaintiff must have to prove in court that during the duty period there is a medical negligence did by the doctors. The another thing is the damage. Damage means again plaintiff have to prove in court that damage, there is damage, yani some injury is happening, or in severe cases death is happening by the doctors. The fourth thing is the direct causation. Okay, it is more important. In court, the plaintiff must have to prove that the injury or the death of the patient is occurred only and only due to the negligence of the doctor. If there is no any direct relation between the injury or any death with a doctor, then the case is again invalid. So these four things that plaintiff must have to prove in court before considering doctor as a negligent. Okay, thank you.